Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. I have been a cardiologist in Houston for more than 40 years. The focus of this presentation is, should you be worried about shortness of breath? What is shortness of breath? What causes shortness of breath, particularly from a heart point of view? And how do we diagnose the underlying cause for shortness of breath? And what are the things that you need to be concerned about minimizing the shortness of breath if it is associated with your heart condition? So let us continue with the feature presentation. During the 40 years I have been a cardiologist, we see patients for a variety of reasons, the most important of which are chest pain, palpitations, and shortness of breath. And each one of these represent a different category of disease involving the heart. The chest pain relates to the blockage of the coronary arteries, reducing the circulation to the heart muscle and thus causing pain known as angina. Palpitations represent irregularity in the heart rhythm, either be it as extra beats or rapid heartbeats or even slow heartbeats, leading to palpitations, dizziness. The third most important reason we see patients in cardiology is because of shortness of breath. Shortness of breath is related to the heart's inability to meet the oxygen demands at a given particular moment. As a result, the heart rate goes up and there are stimulus sent to the lungs to increase the respirations. Even you see marathon runners or sprint runners gasping for oxygen at the end of their run. That's simply because when we increase the oxygen demand more than the heart can handle, the heart tries to compensate by increasing the heart rate and by stimulating our lungs to increase the respirations, which results in shortness of breath. And primarily, shortness of breath relates to the heart failure, or what is known as the hypertrophic cardiomyopathy, or the diastolic heart failure. I have a separate video on chest pain, and I have a separate video on palpitations, so let us focus on shortness of breath. Besides the heart, there are a number of other conditions that can cause shortness of breath related to the lungs. Asthma can cause shortness of breath because it causes constriction of the airways, thus reducing the oxygen available to be absorbed into the circulation. COPD, we have seen people gasping for breath, carrying oxygen tanks, or people with pneumonia or bronchitis who can develop shortness of breath. Even people with obesity can have shortness of breath at rest. How do we assess shortness of breath? How do we really determine how short a patient is when it comes to breathing? We ask very simple questions. How much can you walk? Can you walk to the mailbox? Can you walk around the house? Do you get short of breath just sitting in the couch? I shouldn't use the word couch, sitting in the couch, but anyway. Or do you get shortness of breath in the middle of the night? You wake up in the middle of the night with shortness of breath, which is known as paroxysmal nocturnal dyspnea. Dyspnea is another term used for shortness of breath. It's just a fancy medical term for the simple shortness of breath. Dyspnea at night. How do we get shortness of breath when we are lying down and sleeping? That happens in patients with heart failure when all that swelling in the lower extremities is absorbed during sleeping because your legs are at the same level as the heart, and that extra fluid causes congestion in the lungs, reduces oxygen supply, and that leads to shortness of breath. Do you get short of breath just doing routine chores like changing your dress or cooking? So these are all things which help us to assess the degree of shortness of breath. It's not enough if somebody just says, well, I'm just short of breath. And that is a common way people answer that question when I ask them. So I get to be more specific. I said, can you walk to the mailbox? Can you walk around your block? And if people say, they're getting short of breath, we need to go deeper and find out, do you have chest pain with shortness of breath? That may suggest not only heart failure, but it may also suggest blockages in the arteries causing damage to the heart muscle leading to heart failure. Palpitations. When people have very rapid heartbeats, the heart cannot get enough oxygen, and that can increase the breathing. And people get fatigued because of heart failure. They get short of breath, they get tired, the heart cannot meet the demands of the oxygen, and thus the whole body becomes kind of weak and tired. If someone says they are having fever, cough, or congestion, it may be related to lungs. It could be an acute condition, or it could be a chronic, lifelong condition like chronic obstructive pulmonary disease. The next thing we ask is your shortness of breath getting worse? How was it like last week? Shortness of breath can get worse in patients with heart failure if there's a change in their medications, if there's change in their diet, if they eat too much salt, they retain fluid, and immediately they can develop heart failure or worsening of heart failure, and they can have shortness of breath. Medications, if people skip heart failure medications, their symptoms can get worse. Or if people have kidney problem, if they are on dialysis, they generally get short of breath just before dialysis because there's too much fluid buildup. And fluid buildup is another cause for shortness of breath. Anemia is another important cause for shortness of breath. If people are saying, I was able to walk for a mile, but now I get so tired after walking half a mile. So we do blood tests to find out what's causing. So let's look at and see what are the things that we do as a cardiologist to evaluate somebody's symptom of shortness of breath. It is not so simple as most people think. We have to do a very comprehensive, thorough examination of the cardiovascular system and tests to determine what exactly is causing the shortness of breath. We do an electrocardiogram to look at the heart rhythm. Are there any extra beats or rapid heart rhythms? Chest x-ray to look for any evidence of heart failure, heart enlargement, or like COPD or pneumonia. Echocardiogram is an important test to look at the structure of the heart to see if the patient has enlargement of the heart, weakening of the heart muscle, scarring of the heart muscle, and if there are associated leaks here in the valves that can lead to increased cardiac work, or there is a narrowing of the aortic valve, especially the aortic valve, that can cause shortness of breath. We also measure pressures in the heart. When patients develop heart failure, because of increased congestion, there's increased pressure buildup in the lungs along with the congestion that can lead to shortness of breath. And that tells us how significant the heart problem is, how far advanced the heart problem is, and whether the problem is reversible or fixed. That's why in patients with heart failure, we classify them based upon their symptoms. If they have symptoms with normal activities, it could be class 1. If they're having symptoms just sitting down or lying down, that is class 4 heart failure. So the degree of symptoms of shortness of breath tells us how far advanced their heart failure is. If they are having chest pain, we do a stress test to see if blockage of the coronary arteries is leading to the damage to the heart muscle, weakening of the heart muscle, enlargement of the heart chamber that leads to heart failure and causes shortness of breath. Of course, blood tests I mentioned to look for anemia, kidney problem, and electrolyte imbalances. Thyroid is another thing that can cause heart failure and rapid heartbeats that can cause shortness of breath. If people are having rapid and irregular heartbeats, we do what's called a heart monitor or continuous monitoring of the heart for like 24 hours, 48 hours, or maybe for 3 years continuously. Or if somebody has a pacemaker, they are continuously monitored forever as long as they have a pacemaker and stored in the pacemaker battery, which can be analyzed at any time. And if some people have leaks and advanced heart failure or something like that, or hypertrophied heart failure, then we do cardiac catheterization to look for changes in the heart pressure, changes in the heart function, which is usually measured as ejection fraction. That is, if the heart chamber receives 100 cc's of blood and it pumps forward 70 cc's of blood, that is 70% of the blood it has in its heart chamber is pumped into the main circulation, that is 70%. That is the ejection fraction. That's an important terminology for you to remember. When you talk to cardiologists, they always say, oh, I had all these tests done with my previous cardiologist. I said, okay, what did he say was your ejection fraction? The normal ejection fraction is 55 to 70%. Some patients with heart failure, their ejection fractions could be like 15-20%. I had one patient who had an ejection fraction of like 10%, 7%, because their heart muscle is so enlarged, it is so damaged. Instead of squeezing like this, the heart muscle, their heart is sitting there, tuk, 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 tuk. It's not pumping enough blood. So you can understand how patients could be short of breath just sitting in the couch. There you go. I said sitting in the couch again. How do we manage? Of course, we manage patients based upon their underlying condition. If they have a valve leak or a valve narrowing, we can mechanically fix that and improve the symptoms of heart failure and shortness of breath. If they're having advanced heart failure, their heart muscle may be enlarged, it may be weak, and we use various kinds of medications to reduce the strain on the heart muscle, improve the forward cardiac output, thus increasing the oxygen supply to the body. And from your point of view, as a person who is experiencing shortness of breath, if you are having an underlying heart condition, here are some important things that you need to focus upon. You need to specifically make sure that you take your medications on time and make a note of that. You need to restrict your salt intake to less than 2.3 grams or maybe even lesser than that if you're having heart failure, and particularly if you're having kidney problem on top of heart failure. Fluid restriction is also an important thing, because if you drink too much fluid, then it's going nowhere but into your lungs, which causes more congestion that increases your shortness of breath. And we generally recommend patients with advanced heart failure to monitor their weight, their daily intake of food, particularly salt, monitor their pulse, blood pressure, pulse oximeter, and monitor if they are having any changes in their symptoms. In fact, we tell heart failure patients, if you gain more than 2 pounds, you need to call the clinic to see what can be done. And if you're having infection or flu, that can increase the symptoms, and that's something that needs more attention. That's why you see patients with heart failure more often come to the hospital because of flu, bronchitis, or pneumonia, because that can worsen their heart failure symptoms, particularly shortness of breath, which needs attention much earlier than if you are a younger person. So ladies and gentlemen, this is a very quick synopsis of what is shortness of breath, how it is manifested in your body, and what are the causes of shortness of breath, how we diagnose shortness of breath in relationship to the heart, and what are the things you need to do. I hope this has been educational to you, and hopefully it will help you to keep away from cardiologists and especially hospitals if you are having shortness of breath related to your heart, by following certain simple steps that you are supposed to do. Thank you so much for watching this presentation. We have hundreds of educational videos on heart and heart disease on our channel. Please do subscribe to our channel. Please do watch those videos, and I will see you in the next presentation.